All right, all right, all right. What are we going to do? We're going to talk about drugs. What? So, we just went over part C. C for cookie. No, no, no. Medicare Advantage, guys, pay attention. C is for Medicare Advantage. What's that little way we're going to remember this Medicare thing? Remember, Medicare Part A and Part B is original Medicare. It's provided by the federal government. You can see your way out of here. What does that mean? Part C, your way out of here. You can't have a private Medicare company, a Medicare Advantage, take over, right? Or complement, I should say. You can't have your Medicare Advantage, Part C, complement your original Medicare. It takes it over, right? And what does it do? It provides your hospitalization, your physician, even your drugs. Now, what are we going to do? We're talking about that Part D, right? Because if Part C includes the prescription drugs, original Medicare doesn't. It's only the Part A and B. Remember, C is out of there. D is for drugs. Now we got hospitalization in Part A. We've got physician services, diagnostics, skilled labor, and things like that in Part B. Now, if I went to the hospital didn't give me the care that I needed, right? They gave me the facility. The doctor provided me the care. And as much as I hate to say it, let me just read this line out here for you, right? The philosophy of our medical service industry is to rely on drug therapy to treat chronic conditions. Therefore, to stay healthy, you will need prescription drugs. Look, I'm just the messenger. I prefer you to eat some broccoli, maybe invest in a couple of super foods once in a while. I'm not the biggest advocate of drug therapies. You know, don't ask me if I got the freaking COVID shot. None of your business. All right? Anyway, so this Part D, if you look at it from a healthcare standpoint, think of how important this is, because they're trying to tell you that you can't stay healthy if you get chronic conditions without having prescription drugs at your disposal. Okay? So when it comes to Part D, what are the costs that are going to be incurred in you being able to complement your original Medicare with prescription drug services? Well, you're going to pay a monthly premium, just like you do with Part B, right? If you didn't pay into your 40 quarters of Social Security, did you qualify for Part A with no premium? No. But anyway, so Part A does have a premium. It's just you're entitled to get it without a premium if you work, right? Well, Part D is no different. You don't get any part of Part D free, but it does come with a premium just like Part B. Okay? Now, in addition to the monthly premium, you have an annual deductible. Also like Part B, you have a copay, right? So this copay is either going to be a stated flat amount per prescription or a percentage of your prescription costs. Now, the type of medicine that you're getting, Part D does cover everything from your generics, your specialties, and your name brands, all right? This part isn't tested at this level, but your Part D plans are required to have every single category of therapeutic drug in their plan. Now, it doesn't mean that they have to have every drug in their plan. It just means that if you have a specific issue, your plan is going to have a medication for that specific issue. Okay? Now, the classification, like some of these drugs are biologics and crazy things like that, that does affect the amount of your copay, okay? Now, when it comes to the prescription drugs, and let's just say, you have a couple of issues and you're paying out, there's actually an annual limit that you could reach. If you reach that annual limit, all of your coverage stops, okay? You'll be responsible for 100% of your prescription drug costs. In this area of no benefits, it's called the donut hole. Please do not ask me why these people call it a donut hole, okay? Donut hole is that area, that time frame that begins the moment you reach your annual limit, okay? It continues with no coverage until you reach an amount of $5,100. That $5,100 is considered a catastrophic amount. Once you reach a catastrophic amount of your prescription drug costs, you get your benefits back. Your donut hole has ended. Donut hole. Seriously. But anyway, once that happens, you're back to either a flat fee, like for generic drugs, you're looking at $3.35 for a generic, $8.25 for a brand, or you could move away from that flat fee that we were discussing and go with a 5% of your total prescription cost, okay? Now those copays kick in after you've reached your catastrophic limit, which is you spent you spent over $5,100 in prescription drug costs, okay? Now, these Part D plans, they are private companies, okay? But they are required to go ahead and provide you with a bare bones minimum. So just like how we discussed Medicare Parts A and B, if Part C was going to take over, they had to provide you with absolutely everything that original Medicare gives you. Well, Part D is the same thing. These plans do have some freedom in there to move around and which drugs to take, but remember what I said? They have to have a drug in every therapeutic category, so you're guaranteed to have one there, right? But the benefits, they could give you other benefits because they are private. They're still trying to entice you in there. You may get other benefits in there. I'm not going to list them out specifically because I can't think of any right now, but they're there in theory. Now, your HMOs, remember those managed care organizations that you can get your care from? Well, they focus, your managed care, your HMOs, and your PPOs, those actually have drug services included. You cannot sell a standalone prescription drug plan to somebody who has a Medicare Advantage plan like an HMO or a PPO. That's very important. I don't know if they're going to test you on that during the pre-licensing, but if you're going to be moving on and selling Medicare Advantage, believe me, you're going to have to know that, all right? Now, exceptions do exist because there's some plans out there for Medicare Advantage that are called cost plans or savings account plans, and some of those don't come with prescription drugs. But that's a little bit too advanced for this class. Just know that exceptions do exist, but you're not going to be tested on those exceptions. Now, Medicare Part D, do you remember what I told you about Part B? It was voluntary. Do you remember how voluntary that was? It was like, yo, you don't have to take it, but it's in your best interest to take it, right? Same thing with Part D. Part D for the drugs, because you're going to need it. Why? Because you can't eat a superfood and get healthy. Anyway, well, you're not automatically enrolled, okay? So just because you're not going to be able to get healthy if you have a chronic condition without drugs, didn't mean that they automatically enrolled you. You are responsible for accepting the Part D benefits, okay? Now, if you don't accept Part D benefits right when you're first eligible for Part D benefits, you will be penalized. See, there we go. There's this whole thing again. Oh, it's voluntary, but I'm going to penalize you if you don't do it. Does that sound voluntary to you? It sounds like, if I said anything else, I'd just be throwing shade, so I'm going to stop right there. It's voluntary. You could choose to get the penalty if you like. That penalty is 1%. Doesn't sound like much, but it's 1% per month. So, ... if you choose not to enroll in your Medicare Part D when first eligible, and you decide to go ahead and enroll 12 months later, how much of a penalty did you incur? You incurred a 12% penalty that you're going to pay until you die or drop coverage. This is not, 1% isn't bad, but when it's 1% monthly and it stays there forever, sounds like extortion to me anyway. So, in a nutshell, Part D is voluntary. It covers your prescription drugs. What type? All types of prescription drugs. No vitamins, please. Now, with that, what do you have to do? You're responsible for a monthly premium. You're just responsible for a copay. You're responsible for a deductible. Remember this donut hole? When is that gap of no benefits comes in? It comes in once you've reached your annual limit. How much is your annual limit? None of your business. You're not tested on it. That's why I didn't tell you. But what you do need to know is that after you hit that annual limit, there's no benefits. Until when? Until you reach catastrophic limits of $5,100. Then you're back in business again. You're getting that copay. Remember, generics are a little bit cheaper. Name brands are a little bit more expensive. Or you can go ahead and, it might be 5% of your overall prescription cost. So, my friends, that is the good drug word for the day. Now, what I'm going to do, I'm going to bring my man Ronnie up. He's going to give it to you in that Spanglish us Puerto Ricans love so much.